Epidermal nerve fiber density testing, specimen collection, punch biopsy procedure video. Localized over the lower lateral leg, measure 10 centimeters proximal to the lateral malleolus. Mark the site with a skin pen, then prep with an alcohol wipe. Infiltrate lidocaine with epinephrine proximally, taking care to avoid the biopsy site directly, in an inverted V pattern. Finish prepping the skin surface with an iodine wipe. Perform a 3 mm punch biopsy as perpendicular to the skin surface as possible. Slowly push the punch instrument down while rotating back and forth, allowing the blade to do the work. Enter the skin to the level of the subcutis, cutting through the epidermis and dermis. Gently remove the biopsy specimen as atraumatic as possible. When removing the biopsy specimen, use atraumatic forceps, gripping the sample beneath the skin surface. Be gentle and avoid crushing the epithelial surface. Immediately place the sample in the yellow Zambonis fixative. Prior to sealing the container, verify the sample is submerged in fixative. Apply the hemostatic agent, topical antibiotic, and gauze with a bandage to the biopsy site. For additional information or to order supplies, please visit BakoDx.com/ENFD.
Hi, I'm Dr. Olga Lupshin, and I practice in Sebring, Florida, right in Central Florida. And I've been doing the epidermal nerve fiber density testing for quite a bit of years now. And I'm just here to tell you, I love doing this test. My patients are so grateful because we're getting such quick results regarding their neuropathy status. For example, when they come in, if I suspect neuropathy, and I go ahead and tell them we're going to do the test, it only takes me a couple minutes. And I've got everything in the kit, which I've opened up right here. All the supplies are in here. I go ahead and numb them with some lidocaine with epi. I go ahead and do the biopsy, 10 centimeters above their malleoli. And within a week, we have the test results. And I'm able to tell them if, number one, do they have neuropathy? Number two, do they have an early evolving neuropathy all the way to, is it a severe advanced neuropathy? And then we can gear our neuropathic foot care, preventative care based on all that. I'm able to educate them, give them handouts, show them on diagrams where we're at with their feet, what we can do, either laser treatment, orally, physical therapy, and how to avoid getting a neuropathic foot ulceration. So again, I'm Dr. Olga Lupshin, and I've been doing the testing for a handful of years now and having great experiences with it. Thank you.
optimal nail specimen collection for onychodystrophy testing. Before we get started, you will want to wipe the collection site with an alcohol wipe. First, debride and discard the distal nail as the diagnostic yield here is decreased. Then you will want to obtain a specimen from the most proximal area of the nail and hyponychium, where potential fungal elements would be most abundant. A curette can be used to obtain any additional subungual debris, increasing the potential diagnostic yield. Place the dry nail samples and subungual debris into a dry keratin bag for lab submission. BakoDx is your trusted partner in treating onychodystrophy at its source.
Laboratory confirmatory testing is key, especially because we have a 50-50 chance of diagnosing onychomycosis. So that laboratory confirmatory testing is what is going to help us make that correct diagnosis. 50% of the nail disease we see is onychomycosis and 50% is something else like psoriasis. So you want to make sure, number one, that you're dealing with onychomycosis and not another disease entity, because you certainly wouldn't want to give an oral antifungal for somebody who has nail psoriasis. And likewise, depending on what the results come back as, if it's a mold or some sort of exotic dermatophyte, you want to make sure that you are choosing the correct drug for that bug. I think it's really important to get the appropriate specimen for onychomycosis, because there's a lot of misinformation out there as far as training goes, and the reality is we want to get where the infection starts, which is the nail bed. And it's all about making sure that you get that proper specimen, because you don't want to have a false negative.
The collection method for a web space is a simple superficial skin scraping and performed in office. The scraping can be performed utilizing a 10 or 15 blade, however any size blade may be used. Specimen collection may also be accomplished through an appropriate curette procedure, should you be inclined. The specimen is collected into a specialized skin collection pack. Place the specimen on the colored surface. This allows the collector and the laboratory to clearly visualize the sample. Any amount of visible tissue is typically sufficient for testing. After collecting the specimen, fold the bottom part of the collection pack, labeled A, up to cover the sample. Next, fold the B and C side flaps. Remove the paper covering the adhesive strip and fold flap D down and press firmly to ensure adhesion and closure. Complete the patient information on the rear panel and insert the collection pack back into a resealable plastic bag. Now place the resealable plastic bag inside the biohazard bag and seal. Fold the completed requisition form and place it in the outside pocket of the biohazard bag. Place this into the provided clinical lab mailer and send your specimen to the lab for testing. For more information, visit BakoDx.com/webspace or contact your account manager. BakoDiagnostics is your trusted lab partner in the treatment of web space infections.